What can make public spaces more accessible for mobility aid users? Imagine walking through a park or heading to a medical clinic and feeling completely confident that you can move freely without obstacles. That's the goal of making public spaces accessible for everyone. When spaces are designed with the needs of mobility aid users in mind, it means removing barriers that can make movement difficult or impossible. This isn't just about following laws. It's about creating environments where all people can participate fully and with dignity. To start, pathways and walkways should be wide enough for wheelchairs and scooters to pass comfortably. A minimum width of 30 inches is needed, but 48 inches is better for two devices to pass side by side. Surfaces should be smooth and even to prevent tipping or tripping. Curb ramps at intersections are essential for crossing streets safely and should have a slope no steeper than 1 to 12. This means for every 12 units of horizontal distance, the ramp should rise no more than 1 unit. Building entrances need at least one accessible door that opens automatically or with a push button. Doors should be at least 36 inches wide to allow easy passage. Restrooms should have stalls large enough for a wheelchair to turn around, with grab bars installed for support. Sinks should be at a height that can be reached from a seated position, typically between 30 inches and 34 inches from the floor. Parking spaces close to entrances are a must, with at least one designated accessible spot for every 25 regular spaces. These spots should be clearly marked and include extra space on the side for easy entry and exit, especially for vans with lifts or ramps. Public seating areas should include spaces where mobility aid users can ranges in their devices comfortably. In transit stations or medical facilities, clear pathways and waiting areas free of clutter are vital. Turning space is necessary in tight spots like exam rooms or restrooms, where a turning circle of at least 60 inches is recommended. Corridors should have wider sections every so often to allow passing or waiting comfortably. Elevators or platform lifts must be large enough to accommodate mobility devices and easy to operate, with controls at reachable heights. Transportation options also play a big role. Buses, trains, and stations should be designed so that people using mobility aids can board, ride, and disembark safely. Ramps or lifts on buses, level boarding at train platforms, and securement areas inside vehicles are all important. Signage should be clear, with visual and audible announcements to help users navigate transit systems easily. Staff training is another key part of accessibility. Employees should know how to assist respectfully and operate accessibility features properly. Policies must be flexible enough to allow use of lifts or ramps whenever needed, regardless of whether someone is in a wheelchair. Regular maintenance of accessibility features is essential. Broken elevators or blocked ramps can create serious barriers. In healthcare settings, accessible public spaces mean patients can reach their appointments without extra stress. Exam rooms, waiting areas, and restrooms should be designed to fit mobility aids comfortably. Clear, unobstructed pathways and accessible parking help reduce physical effort and frustration. Staff should be prepared to assist with transfers and provide information in formats that everyone can understand. In the end, making public spaces more accessible for mobility aid users involves thoughtful design, ongoing maintenance, staff education, and inclusive policies. When these elements come together, everyone can enjoy community spaces, healthcare services, and daily activities with independence and confidence.